Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. This is Beth, who is part of our team, and we're blessed to have her. She is not blessed because she has chronic TMJ problems, and I want to talk to her a little bit about what she's been experiencing and tell you a little bit about what I see and how I can try to help patients also. Clenching the teeth can be a factor in initiating TMJ problems. And TMJ problems can be a problem. And it can be a minor problem, it can be a moderate problem, or it can be a severe problem and make your life miserable depending on how bad it is and how long you've had it. So what's helping you now as far as treatment is concerned, or what you're doing now?
Well, the first thing I have to say that made the biggest improvement for me was getting a bite guard. That actually kept my teeth from clenching like tooth to tooth.
Right.
So I wasn't, putting pressure on the teeth. It's going into the bottom and the top of the bite guard, and that has made a huge improvement. I used to wake up with my jaw so tight that it was hard to get it open, and then when I would have to go to brush my teeth, it was kind of painful. And it would go up into my ears, and I would get the headache from it, and it was very, very uncomfortable. So the bite guard, I would say, was probably one of the best things I did.
Bite guards can be very helpful. On the other hand, I was just talking to Doreen, who works in our office, and you may have seen her on other videos, and she had a bite guard too. And in her case, the bite guard actually precipitated her TMJ problem, made it worse because the bite guard wasn't properly adjusted or properly fitted. Now, we make custom bite guards here at the office, but many people just go out and they'll buy a bite guard, kind of over-the-counter thing, and fit it for their mouths, and sometimes those are okay. But if a bite guard is not adjusted properly or doesn't fit right, it can throw your jaw off and actually contribute to or initiate sometimes TMJ problems. I have to tell this one story. So when you have a TMJ problem, sometimes the jaw will actually lock up and it's frozen, your jaw is frozen. And Beth, you talked about some people that had that frozen jaw.
Yes, I know someone who was actually on a plane and he yawned and his jaw, I think, locked in place with his mouth open, and he had to go the rest of the flight with his mouth open, unable to close his mouth, and I'm assuming there was some drooling involved. I'm not sure. But as soon as he landed, he had to go to the emergency room and have help to get that unlocked and the jaw put, kind of replaced where it needed to be to get some relief. And boy, that's always scared me, the thought of that.
Well, it can happen. And typically when your jaw locks, it sort of locks in a forward position. And in the past, occasionally, I've had patients with jaws that have locked, and if you press down on the jaw, pressing down and backwards so it goes back into the joint, very often that will free it up. But I remember years ago, this is kind of a horrible story in a way. Years ago, I had a patient, and his jaw used to lock, and nothing would unlock it. He used to lock on his left side. He was frozen. Nothing could change it. And so I tried pushing on his jaw, pushing it, to unhinge it. Nothing was working. And I said, hey, listen, I'm going to have to hit you. So open-handedly, I did give him a really hard smack. I'm talking a very hard smack on the side of the face. And he was so grateful, I can't tell you.
He actually paid you for it.
It worked. It actually happened several times, but with this gentleman anyway.
Wow.
It was very interesting.
That would be very scary.
But there are a number of things that can initiate TMJ problem. Clenching is certainly one of them. Fillings that are uneven or an uneven bite. Posture that's bad. Any of these things can throw the joint off and start the problem. Now, one of the things that Beth has had that has helped her a lot, she was telling me, was
Actually, Botox
Botox.
injections. They are put somewhere, I don't know if it's exactly in the muscle or near the muscle, and that actually helps to relax that muscle so they don't tighten up and you don't have that clenching as much. And for me, that, along with the bite guard, I think has been life-changing. I'm able to sleep. I do try to avoid chewing gum because that's another thing that really is not great for it.
Chewing gum can be a major factor. I've experienced TMJ problems to some extent myself, particularly if I chew a lot of gum for whatever reason, which I don't normally do.
Right, but yeah, between the Botox and the bite guard, those have really, like I said, they've changed my life and made it so much more comfortable. I don't crack when I open my mouth. Poor Skylar, who runs the camera, I used to sit next to him, and we would be talking, or I would drink water, and my jaw would just crack every time I opened or closed my mouth. So it doesn't do that anymore, which is really a huge relief and much more comfortable.
And when I have a new patient, we always check for TMJ problems. And I would say probably a third to a half of those patients have a click, which means that it's going slightly out of joint. One or both of the joints click. It's usually one, but most of the time the patient's been living with it for a long time. It doesn't bother them. It's not a concern, and so we really don't do anything about it as long as it's not a problem. When I see a patient who does have TMJ problem, we do recommend an occlusal guard or a bite guard and shutting up. In other words, don't talk any more than you need to. Don't yawn any wider. Try not to yawn. Don't chew any hard foods or spend a lot of time. In other words, rest your jaw as much as you can rest it. Give it a chance for that inflammatory response to subside a little bit. Possibly take an anti-inflammatory, ibuprofen or other anti-inflammatories to minimize any inflammation that may be there. Sometimes muscle relaxants can be helpful. Stress is a big factor, so sometimes meditation can actually help if you can do that. Generally, it's contributed to by clenching or grinding the teeth together. So if you can do something to change the nature of that musculature, with clenching like this all the time, and one of the exercises is opening your jaw against pressure. So instead of closing your jaw with pressure, you're stretching the muscles the opposite way to kind of compensate for the clenching and grinding and contraction of those muscles. So it might be putting your thumbs under your jaw like this with pressure and just working those jaw muscles against pressure, exactly the opposite way of what tends to often initiate TMJ problems. You might be able to use warm compresses if you're really having a lot of discomfort. Sometimes that can help. When you're sleeping, try not to sleep on your stomach or on your side because it can press, particularly on the side if you're having discomfort. It can make that worse. Try to sleep on your back. Also, try to notice if you have any habits like biting your nails, chewing on a pencil, as we talked about before, chewing gum, anything that might be straining your jaw. Also nicotine, in whatever form it may be, one tends to clench a little bit more, so it increases the tendency to clench or grind one's teeth. So those are things that that you can avoid. Try to have good posture. There are posture exercises, throwing your shoulders back and your head forward. Well, there's so much involved with TMJ, and I have a feeling we're going to be exploring a little bit more in the not too far distant future. But I hope this was interesting to many of you. And Beth, I really appreciate the feedback and the experience that you've had.
You're welcome. My pleasure.
Not bother you too much in the future. And once again, we'd love to hear from you. We'd welcome your comments, your questions. Subscribe to our YouTube channel. There's a bell. Hit the bell so you'll be alerted when we have a YouTube video. And again, thank you for watching, and have a healthy mouth. No healthy mouth, body's not going to be as healthy as it could be. Otherwise, have a wonderful, wonderful day. Take care.
Restore your smile and your health Visit drnemeth.com to schedule your appointment today.